Stanton here with a SEP Frontline. Once again here at the master class, talking about the independent groups here in Dallas. Packed house once again as the conference that sold out in 5 days. Very popular physicians taking control of their futures and starting, maintaining, and growing physician-owned groups. Dr. Beth Griffin, she is with us here today. She's been one of the faculty as well. Kind of dive into some of the things, and the topic we're going to talk about after I get some background, but is the idea that, in my group, I just took over as president this last month, and the same person had been the president since the group was founded 30-something years ago. And with that being said, there's a lot of things that are being done that they probably don't even think about. It's on autopilot at this point. And so then trying to unwrap all that stuff to create that business structure is going to be a little bit difficult. So we want to talk about that a little bit. We're going to talk about some of the retention side of things and maybe get into a little potpourri and make sure we wrap up in time to make it to the evening reception coming up. So first, give us a little background on yourself, where you work in your group.
Well, thanks so much for having me, and congrats on your position, of
Thanks.
course, as well. So I am based in Milwaukee, Wisconsin. I actually grew up there and did my residency down in Chicago and went back to Milwaukee for my first and only job and career. And so I'm currently the president of our group, Emergency Medicine Specialists. We are a group of roughly 250 clinicians strong. We currently staff 12 emergency departments and 8 urgent cares. And throughout the time I've been with the group since 2008, we've grown significantly. And so I have the experience of being part of a smaller group, 12 docs, 1 to 2 sites, and now a bigger group with the footprint that we have. And so it's been an exciting journey for us.
Well, then let's just jump right into that part of it. Just because you mentioned it, I'm going to jump in it because your group had this very quick, rapid expansion. A lot of us have opportunities for very strategic expansion, one hospital, something. You guys had a really big, rapid expansion.
We did. So in 2022, we had the opportunity to expand within our region, and we went from 5 emergency departments to 13 in 90 days. And we also added a number of urgent cares during that time as well. So it didn't just happen overnight, though. The 90 days was really that time period where it was public and all the things were happening. But before that, we did have a strategy within our group and some planning ahead of time to position ourselves to be ready for growth. So we knew that was part of our strategy for our group. We knew that it was important that we would be ready to do something like that, to scale up if the opportunity presented itself. So we were able to get ready with an HRIS software, for example, and other things that we could easily scale if we did have that opportunity to grow like we were hoping for.
So give us some of those key infrastructure things that you put in, because a small group kind of runs itself. It's the mom and pop shop. It's the corner gas station. It just does. But now you're actually getting in. I think you mentioned you hired 50 docs, like 70 non-physicians, all the same time coming in over that 90-day period. Talk to me about some of that infrastructure that you had to put in to really take it from that smaller, personal, legitimately small group now into something that has more of that corporate business structure.
Well, I'll start with this by saying it takes a team. So nobody's going to be doing this themselves. There's no way that you could scale that quickly without a significant team behind you. And so for me, my team started with one of my most important roles, our chief operating officer, who had experience actually in manufacturing and was able to help position us as a business and as a company to grow. And so that started by beefing up our administrative team, making sure we had a dedicated HR leader who had a very complete and robust onboarding process for all of the new clinicians we were bringing onto our team. A credentialing specialist was another thing that we didn't have a dedicated resource for that in the past, but we needed that, especially with this large uptick credentialing, both with the hospital system, but also with payers. And there's a lot that goes into that, obviously. And then on the finance side, making sure that we had scalable and robust systems in place to making sure that payroll ran smoothly and our accounting team was ready for that type of growth as well.
And we heard from your COO as part of the conversations. This is why you need to register for this conference early. Great content. And I'm actually going to ask a personal question at this point, because you brought in the COO, you brought in all these things. Where do you feel like that transition point is from outsourcing, let's just say with a practice management group of some sort that probably has a number of accounts, so you don't have people that are just necessarily dedicated to you but have like several different things, versus starting to bring it in-house and local?
Yes, that is actually a big, important process and something you're kind of continually always evaluating. And so, first, you're looking at what is the work to be done? How much work is to be done? How many hours is it legitimately going to take daily or weekly? And then, do I have the resources in my group right now to do that, or am I outsourcing that? And if I'm outsourcing it, is it enough to occupy a full time job? Or maybe somebody you bring in who might do 2 or 3 things that you're outsourcing. And it might be time to combine those, and it would be something reasonable for one person to have that skill set to do. So I think it's just always evaluating how much time am I spending either with a vendor on outsourcing that, and how much do I really need? And does it make sense then to bring that in house with 1 or 2 people who maybe have that skill set?
So let's dive into the leadership now, into the physician leadership of these groups, and always having that pipeline. We talked to Dr. Gary Katz, and he talks about an heir and a spare to his group. How do we build that succession plan? Because I think there's an opportunity to be too much change, and there's also the opportunity of getting stagnant. And if there's good leaders, you want them to be able to lead, but there has to be a succession to where you're not dependent on that person, to where when they leave, it's going to disrupt the function of the business.
Exactly. And that is one of my favorite parts of leadership, actually. I love our team, I love our docs, and being able, I think, to recognize talent within your physician group and opportunity that you have to really mentor them and come alongside of them. And it is, I think, really the indication of a strong, healthy group when you have multiple leaders who are able, to take on a role and to lead. So for us, we've been very intentional about that. And we talked about our growth a little bit, but with that, the last year or two has been really focused on that leadership development and really the depth of our leadership bench and who we have available. And so it's really finding those key players on your team that have that potential and really investing in them. And so mentoring them, making sure that they develop relationships with the hospital system just like you have. There could be, the propensity to say, hey, I'm invaluable. I'm irreplaceable, right? It feels good to feel that way, but it's not the sign of a healthy organization. You know that, the best thing for your group and for your organization is to have multiple people who understand those roles and can fill them. And so for us, it's come alongside me to meetings. Let's go to this meeting together. And let's work on this project together and make sure that your key leaders within your health system are also very familiar with and have close relationships with a number of leaders on your team, and then start to develop them in their skill set. And for us, it's meant sometimes creating more positions. And for the average working doc, they're like, oh, great, more admin work. That sounds like a really great plan, very sarcastically. But we try to keep it budget neutral. If I create a new position, for example, try to see, where it makes sense maybe, to give some of my hours, for example, to a new doc coming on in a new role. But really find ways to get your docs and your partners more involved at the board, on committee levels, in the hospital, obviously, with medical direction and different committees there, and then, finally with governance and, clinical operations of your company.
And we're fortunate enough that our hospital is willing to pay a certain amount per hour worked by a physician.
That's
Whether it's on a committee, whatever it's on. And so exactly doing that is getting all of our doctors engaged in something, whether it's a committee. I just got 2 assigned to work on our reports because the RCM was getting emails, because we're very transparent. It was getting emails from all these people wanting certain things a certain way, and what we decided to do to make it more efficient is say we're going to have 2-point people, because they're night docs, they love this data, they're going to dive into this data, we're going to let them wear it out, and then all of our stuff's going to go through them, and then they will be the official kind of conversations with the RCM to make sure the reports are coming the way they want. So getting folks involved is key, because just like this being a private group with owners and shareholders, you still have to have that other level or layer of commitment, buy-in to the group, that ownership that is more than just being present and signing into your shifts. So now we've got everything in place. We've got everything there. We want to talk about some of the longevity, some of the strategies there of physician, PA, NP, or non-physician based longevity, things that you all do to kind of keep everybody in the fold, because to me, the best team is a team that sticks together for a career.
Absolutely. And you have so much time and investment in your team and them and you. And you want to make sure that you're creating an environment and a culture and a practice that leads to longevity within their career and that they can stay happy with for many years. There's obviously a lot of stressors that we're up against in emergency medicine. So whatever we can do as an independent group to make that as best as possible is really important. One of the things we talked about this conference and that I was really excited to hear from other groups about is a sabbatical program. Mm-hmm. And I was really excited to hear that almost 80+% of the groups here have some form of a sabbatical program. I didn't realize that it was so so common. And really, I think ER docs have identified that that's an important thing for us to have a break, for us to have some time to step away, to remember who we are as a person. It's easy to get caught up in everything that we're doing and all the stressors that we face. But having some time away from that and remembering the why we do what we do and why we love it, why we're privileged to do that every day is really important to offer to your group. So that's one strategy that we've used. And then if you don't, consider a wellness committee that one of your awesome, talented docs could run, and we have that as well. And really just finding ways for us to get involved outside of the clinical realm, outside of our emergency departments, in the community. And that, again, is like speaking to our why. It's remembering we're making that contact with people in our community, able to help them in different ways, go to schools, mentor kids, be involved in health fairs, whatever it may be. And then it builds, team building within the group as well and creates that culture that's sticky and that everybody wants to stay in and is really proud to be a part of.
Now, one of the last interesting things I saw, of course, the conversations on diversity within our groups. And one of the big areas of debate and question is with the wide variability and variation in like maternal and paternal leave policies. Mm-hmm. Now, how do you all, looking at that, strategies to say, we want everybody to be engaged in this group long term, and we want multiple voices at the table and in the boardroom and wherever it may be. We're going to be stronger and better because of it. How does your group manage that aspect of it to look at opportunities and benefits for people to have a family, to raise a family, and those commitments they need to have?
Right, and I think some of the faculty here really hit the nail on the head when they talked about that. And I think the biggest recruiting tool for, getting women or, adding diversity into your group is, having at least one of those people in the group to begin with, right? And so when people come into the group and they're interviewing or learning more about their group and that they see there's a person and then there's a pathway to support whatever their unique needs may be, or to support having children or having a family or a balance with that, and that there's other people doing it who are happy and are supported by the team in the group, then really I think that is what brings additional, people into the group and additional women specifically.
So interestingly, ours, we never actually even put together like a real policy. Mm-hmm. We just, when we, in this case it was a PA, we just put together a plan to help take care of her and give her that time off. And we've heard a lot of feedback that, some were asking, how are you going to pay us back? Are you going to feed, you're going to get your shifts back? Are you going to pay back the partners that took those shifts? And all those things. And, there's a lot of bad out there that's not doing it great, and there's others that are out there that have decent programs. But I think more and more of our ER groups now are looking at some of that lifestyle wellness type things that we can do, whether it's a sabbatical. And everything I've heard is anywhere from a couple of weeks to a month to a year, mm-hmm. different spacing of how they're going to do it, how it's funded, those types of things. I think there's a lot of options out there. All right, so we're going to wrap up. Because we've got a bus to catch.
Got a bus to catch. Top golf.
So, any closing thoughts, kind of things out there for, mostly in our case for the podcast, the community physicians, folks out there that haven't had a chance to come to this conference so far, on some of those things that maybe this independent group nuggets that you can pass on?
Well, first of all, thank you for everything you do every day. And I would just encourage you to consider coming to this conference. It is something I know for my group, I really want everybody to be able to attend. And that's my goal, is to have everyone to have an opportunity to attend this. The networking with other ER docs who are running their groups, who are doing phenomenal things, who have found really outstanding solutions to challenges that we all face, is just so empowering. It's energizing. It's exciting to be around. And I think it all helps us when we go back to our groups and go back home to just feel like we have that support and that family of all those people around us. So would really encourage you to come to meet some of your fellow ER docs, hear about what they're doing, and share what you're doing. We all learn from each other, and that is how we are stronger together.
Yeah, it's one of the most interesting conferences that it has a breakfast to bedtime feel. So everything's managed from the time you wake up to the time you go to sleep, or probably should have gone to sleep earlier. And what I also learned this morning is the gym is inaccessible between 6 and 7 because all the docs are up there.
Everyone's in it.
Almost everybody's in there working out, with the exception of the 5 machines that are a health hazard and don't work. But it is super busy. Learn that here today. How can folks get in touch with you? If they have any questions, want to reach out, because I'm of course going to be reaching out because your group has gone through a lot of processes that we're about to go through, and we're going to need to implement a lot of that stuff in my group. So how can folks get in touch with you?
They can always email me, beth.griffin@ems-wi.com. We have a website as well, ems-wi.com. And I'm happy to chat anytime, to give my cell phone number out. I'm always, an open door to talk to any docs who have questions, anybody that I can support and connect with. I'd be happy to.
And they do have a really, really nice onboarding process and education process for their non-physicians that they hire on into their group. It's really neat how that is. Actually, I've already passed that on to our chief PA for our group. When you do look it up, you're going to be looking up EMS Wisconsin Emergency. Because that's how you're going to find it. Otherwise, you're going to get a lot of EMS type things.
Turns out EMS is a
very common thing that go around in buggies and trucks
Not a
and pick
unique
people up. And so check that out. You'll find it pretty quickly up there. I think it was popped up #1 for me today when I put in EMS Wisconsin Emergency. As for me, you can contact me, rstanton@acep.org, rstanton@acep.org, @EverydayMed on X. And until next time, I'm Dr. Ryan Stanton. This has been some ACEP Frontline.